Hey guys, it's Jake here. I wanted to make this video to talk about both some tips for clinical rotations for NP students and which kind of I'm going to it's categorized as just general life advice, but it's going to be really crucial for you securing clinical placements, especially if your school does not do that for you. And even if they do, because you can get better placements, better experiences. Um, so also slash walk you through maybe what my week looks like and my day looks like as a last year, actually last semester DNP, FNP student. So, but I didn't want to just do like a day in the life, and I don't have, awesome videography skills to like take all this footage and edit it. So, I did want to give you some tips as well to start so that you could get some good information, hopefully, that'll help you. So, I have two main themes for clinical rotations, and I'll just come right out and tell you, and then I'll explain each of them a little bit. The first is don't burn bridges, and the second is networking, which I'm sure you've probably heard before. These are not revolutionary, these are not new ideas, but I think they're both equally as important, and you should pay attention to both of them just as much. One is kind of retroactive and one is proactive. So let's start with the retroactive one. Maybe you're also an RN right now and you haven't even applied to NP school, or maybe you're very early on. You can still consider this first tip, which is don't burn bridges. I say that because I've my main clinical placement, which was in family medicine, which if you're going into FNP school, family nurse practitioner, it's very important that you find a solid family medicine practice. I know that is hard to come by nowadays, and there's possibly a shift in healthcare that's sort of it's very hard to find a like mom and pop family medicine practice, with some doctor or NP who's just been doing family medicine for a long time, because we're having a shortage. Number one, those providers are aging out, so to speak. Even at my own practice, we've had two retire recently. So I think that school of medicine where especially med students were coming out and going right into a real and true family medicine, seeing cradle to grave patients I think is less frequent, especially based on your geographic location within the country. So, but going back to not burning bridges, my main clinical placement came originally while I was an RN on a floor, just working. I was eating my lunch, and this clinical nursing instructor walked in. We started talking, and she told me she was in NP school, and we had a great conversation. She really actually encouraged me and pushed me to, to pursue nurse practitioner school. Fast forward years later, a couple of years later, a good amount of time had lapsed. I got into school. I was looking for my first clinical placement. I just had the idea to look her up, and sure enough, she was in what turned out to be an awesome clinical environment, a wonderful family medicine practice where she was truly doing family medicine at its core, pediatrics, GYN, a tiny bit of OB, little first trimester girls getting, women getting pregnant and confirming pregnancies. And then, of course, all adults, right? Chronic, geriatric, multiple comorbidities, or just younger and, establishing care and trying and pursuing preventative medicine, as we should as primary care providers. So I want to just bring that up because if you're right now, if you're even considering NP school and you're an RN right now and you're working wherever you're working, it's imperative that you do not burn bridges, because you never know where those people are going to end up in the future, especially if they're already established providers. Like if you work in an office and, then don't, piss off all the people there, and then now you're kind of shunned from that office, so to speak, it's awkward, whatever the case may be. It's just best, and this is also obviously good life advice, it's just best to not burn bridges, no matter how bad situations are. I did a travel contract at what in my opinion, I've worked at about 10 hospitals now traveling the last 3 years, and it was the conditions for nursing was the worst out of all places I'd ever been, and it's not too far from me. But even in that environment, I had one out of a whole contract, I had one great conversation with an NP there, and he had this really cool role where he did half inpatient, half outpatient, and he ran this diabetes management clinic. I mean, it was just like right up primary care alley, with this caveat that he did some inpatient medicine as well. He's super smart, super experienced. He's been an NP for probably going close to 2 decades, and I got his number, I got his contact info. I never actually had to reach out. I'd still love to collaborate with him sometime, someday. But once again, just getting that contact information, even in a situation that was honestly terrible for me, I never went back to that hospital after that, but I still made the best of not burning bridges, and trying to network, which will be the second point. So that was a great example of networking, even outside of the clinic area. However, what's more likely to happen is that once you do find your one, because you'll be lucky and appreciative if you have one good preceptor your first clinical rotation, right? Because especially if you have a school like mine that does not help you land placements, you're just out on your own, potentially cold calling, potentially showing up at clinics and just saying, "Hi, I'm so-and-so, I'd love to, can I do a clinical rotation?" And they can say, "No, we're already full. We don't like students." I mean, they could say whatever they want, and then, you're out of there. So if you get one, most students are pretty appreciative of that. So once you're in there, and even if it's not a place that you love, those providers know providers, right? I mean, that's just how medicine works. They have to collaborate with people. And so you can start working on those relationships. And that's exactly what happened with me. One thing, my family medicine provider had a close friend who became a pediatric nurse practitioner, and she worked in a peds office. Well, we need plenty of peds numbers. In my school, we have to also fulfill not only clinical hours, but a patient minimum encounter sheet of all different ages and types of assessments and so on and so forth. And, a good chunk of that is pediatrics, from newborns up to 18, subdivided into different age categories, and acute or sick and well visits. So I got in with that PNP, and that was amazing because I knew showing up, I was solely going to see peds, so that I could get my numbers. And then from there, you meet other providers, right? Because they're all, if you're in a decent area, they're going to say, "Hey, this is Jake, he's the new MP student," and you meet people. That's just, right, how it works. You should hopefully be cordial enough, and, you should definitely be always putting your best face and foot forward and performance, and be enthusiastic, even if you could care less, even if you hate the place, even if you hate the rotation, even if you are sick or you're feeling bad, you're having a bad day. When you're there for those however many hours, you need to put on a face that says, I love being here. Thank you so much. Do whatever you can to show those people you're here to learn. You're there to help in any way possible. These providers are obviously extremely busy, and you're kind of slowing them down. And so if you can mitigate that in any way possible and just try to become as proficient and efficient as possible, the word will spread. Once again, she had another friend who is an ortho PA, like best friend, and so it's like, hey, do you want to go spend some time with this ortho PA? At the same time, you're meeting co-providers, say within family medicine, and one is a PA and one is an MD. And I never had to, and never really had the desire or felt the need to lean on those people. But if I was desperate, or I, just wanted to get a different vantage point from a PA or an MD or a DO, I could start leaning on those people, right? And it's not, it's no harm, no foul. No one's going to get offended, or it's honestly, at the end of the day, it's you looking out for you, and okay, next semester I have to have this, and this lined up so that I can get my numbers, so that I can get my hours. I mean, and everybody knows that. It's not, like I said, there's no offense taken if you switch out somewhere. But once again, don't burn that bridge. So case in point, my last semester here now, I have 7 clinical sites, technically. I'm only going to use probably 3 of them. But I have urgent care. I'm going to do ER. Obviously my family medicine, my pediatrics. I have ortho. I have another family care. And I have another one that was, it was really a just in case thing that's much farther away, but I met this doctor through another nurse. And so once again, networking. So I have 7 clinical placements I could go to this semester. And that's kind of unheard of. I don't know many other, and it's probably overboard, and that's probably why people don't have it. But believe me, it is better to have more places to go and not need them than to have not enough places to go. Students are paying for preceptorships over $1,000 total for a semester worth of clinical hours. I mean, I don't really think that should be the case. I'm not saying I don't agree with that, and that's, if people want to do that and charge students, I mean, that's not what this is about. But I don't think you necessarily need to do that. I think you can not burn bridges and network, and you can find good people that are willing to help you out. Okay? So those are my 2 main pieces of advice that have helped me succeed in clinical placement and get all my hours and all my numbers and all the different specialties, and have just really great clinical experiences, learning a lot and getting what you need to get done, so that you can graduate. Okay, so I'll quickly move on to, I guess I would rather just call it time management as an NP student, especially I'm probably in the busiest and toughest period of school, and that is the final semester. So being a DNP student, we are finalizing our DNP project, which just comes with a lot of work and presentations and posters and papers and abstracts and everything. Analyzing statistics, going back to statistics and running statistical analyses on your data. You got to really, if you're great with that, then cool. But a lot of us have to go back and hit the books again and remember what the heck we're doing. You're in clinic, so you have to do all your clinical hours, and you're in class. So I have 3 full-time classes, that are just, part of everything, but also I'm part of, the final is adults with complex health issues. So it's kind of tying everything in, and it's giving you patient scenarios that are highly complex, that have multiple comorbidities that have, 8 diagnoses and they're on 10 different medications and they come in with acute complaints, and you have to suss out what's going on with this patient, what are their differentials, how are we going to treat them, are we going to send them to the hospital, and what are they going to do there, and is it your fault, So there's a lot of time that goes into that. So I'm working full time, but I'm almost done with this contract. So on a week basis, if you work full time, that's 3/12s. For me, those days are done, right? I don't do any school work on work days. I mean, I have a commute as well. So that is let's see, 12, 13, 14, 5, 6, 7. It's at least a 14-hour day with commute, if not a little bit more. So, I mean, there's no way to get any school stuff done then, So I plan all my weeks out, and you have to be proactive. You have to think ahead and look ahead. If an assignment is due on a day that you work and you're not going to be able to work on that, you have to get it done early, right? You also need to be in clinic every week in your semesters in order to get done in time. Now, how many days a week will be dependent upon your schedule. So for me, that's 1 day a week right now, because that's all I can really do and manage while still managing all my schoolwork. So I have one clinic day. Now in clinic, I get out around 4 o'clock. So I can still come home and put in about an hour to 2 hours max of schoolwork time if I have to, if I need to. And I do most of the time. It's usually just editing something, finishing something up, or just starting something, looking ahead, planning. I'm telling you, planning is, it doesn't take a whole lot of time. It takes some time, but it'll save you so much time week in and week out if you just know exactly what you have to do every single day to stay on track. And then that only leaves 3 other days of the week, right? Because it's 3 + 1 is 4, 3 other days, 2 what I call my off days, like today, where you can completely devote to studying. And so day in the life of that is, wake up, drop the kids off at school, then you can come back, you have a quiet home, that helps. And I probably put in, 2 to 3 hours of work this morning. I took a quiz, and I completed a discussion board initial post, which are semi-lengthy. It ended up being about 1,000 words, which is average, but there's, multiple references that go into that. There's research and back time and studying of the disease process and everything that goes into that too. So it takes time to make sure you're fulfilling the rubric and all the things that you need to answer. So I got 2 assignments done, which puts me ahead this week already. Then go out, get a quick workout in, do some grocery shopping, come back, make food, eat lunch. That was all about around by 1 o'clock. And then I'm making this video. We'll have to go pick up the kids from school soon, but if you can get all that in before that time, that gives you what I call kind of my second session. And that is less work-oriented and more study-oriented. Oh yeah, I forgot to mention the big part of this last semester is studying for boards, right? So on top of everything I already mentioned, you have the pressure and the planning and the preparation that is required for you to feel confident that you have fully burned through a board review prep book, at least by the time you graduate. And I know that's not, 100% the view of a lot of people, but I really don't understand doing it any other way. I met an NP. No, well, she's not an NP yet. I met someone who graduated last year. I think she said November, and she was still studying. and she was still doing nursing contracts, RN travel contracts. And she said, I think I'm going to take it, pretty soon. I mean, just had no urgency. And now she's been out of school for 4 or 5 months. I don't understand that. But to each their own. You want to take the boards as soon as possible, as long as you're prepared. Okay, if it took everything in you just to pass your classes and to graduate, and you haven't studied, you haven't done any prep, then of course don't just sign up, for the boards and schedule a test time and then just go wing it. But you should be proactive, and you should have gone through at least an entire prep book. Leak, Fitzgerald, those are the main two. I think Barkley is another main popular one. And then you have your review courses, APIA, Hollier. Sarah Michelle is a new and newer upcoming one that a lot of people like. My problem with those is that I'm not a very good auditory learner. And I'm definitely not traveling to some location in the middle of all this madness to go sit in an auditorium for a couple days. That's just, I can't. I'm not doing that. I'm not going to pay hundreds and hundreds of dollars for that. So I don't know if I'll even end up doing one of those. I think I'll purchase a question bank. You should do, now you need to know your stuff. Okay, you can't just do questions and think that that's going to give you a sound fundamental understanding of what you need to know to be a, proficient entry level nurse practitioner and pass your boards. But that's where your prep review book is for, because there's tons of review of actual pathophysiology, patient presentations, classic disease symptoms, treatment management plans, follow-up, diagnostic testing, all that stuff you need to know. Once you have that down, then you should be testing. You should be answering questions that are board question style. And a lot of those you can just purchase those separately from those top, 4 or 5 companies and NPs that have been in the game a long time preparing NPs for boards. So anyway, kind of sidetracked there, but that's my week right now. When my contract is over and I'm not working anymore, I'm going to have about 2 months, my final 2 months, March and April, where I'm not working at all. However, I'm going to up my clinic days to about 3 days a week. So I'll still, it'll kind of feel like I have a full-time job, because I'm going to be in various clinics at least 3 days a week. So those are full days. Those are full work days, just like they're sitting there working. So, that time is still there. But now at least I will have 4 days off that are truly off that I can study. And in those 2 months that I'm not working, that's just prior to graduation, I plan on really, I've already been reviewing NP certification prep material, but I'm going to really get into it. I have a whole plan of study planned out. I have the online access. I have questions, and every day I will be getting into that book and prepping. So anyway, all right, we're at almost 25 minutes. Don't burn bridges. Be proactive, network, and every semester your clinical placements will grow. And then hopefully that week in a life, day in a life routine may help you figure out how you can block your study times. Try to get up, and get stuff done early. I feel like that makes me feel productive, and I know assignments are done. I don't have to worry about them. I can check it off my to-do list. I'm a big list person, so I hit those, and it makes me feel accomplished, and I don't have to worry about them, and now I can focus on other things I need to do in the day, and then I can come back and do some even more studying, which just is like the cherry on top of a super productive day for an NP student. So I hope that helps. If you have any questions, leave in the comments. Bye.